Welcome. This is really a monumental moment for us Against Alzheimer's. We are celebrating the 1-year anniversary of the launch of our consumer-facing platform, BrainGuide. Many of you have been with us from the beginning, and many of you have joined along the way in the last year. And we really would not be where we are today without your support. So we really want to begin this celebration today from a place of gratitude to the many medical experts, people with lived experience, caregivers, partners, people in the community. You've really lent your ideas, your enthusiasm, your inspiration to this work, and we wouldn't be where we are today without that. So we're really grateful to all of you for joining us today and for helping us celebrate the work that we have done so far this year. We're going to share some opening remarks. I guess I should introduce myself. I'm Brooks Kenny. I am here at Us Against Alzheimer's. I'm the new Vice President of Consumer Engagement and Partnerships. And I really had the true honor to be invited to lead this work through the development and design of BrainGuide and now managing the implementation. And I can honestly say it's been a highlight of my career personally and professionally. So thrilled to be able to navigate this workshop and briefing with all of you today. But I want you to hear from others, not just me. So we will have some opening remarks from our chairman, George Vredenberg, as well as from Doreen Monks, who is our person with lived experience who has been with us since I think the very first market research interview we did as we were developing BrainGuide. We want to share some of the data with you today. We want you to hear what's been happening, how many people are engaging in this platform, what are they doing when they come to the platform, and what are they doing a year later? We're starting to collect that data as well. And we'll take a brief look ahead to kind of understand where we're going, what we're thinking about as we continue to grow and expand the platform. We also are very fortunate today to have Marcia Henderson with us, who has been with us from the beginning, as well as Adriana Flores, who are going to share some of their insights from the community. So with that, I'd love to turn it over to George Vredenberg, our co-founder and chairman of Us Against Alzheimer's, to provide a welcome to all of you today.
Well, welcome to all of you on behalf of BrainGuide and Us Against Alzheimer's. As many of you know us, we are a global advocacy organization for patients. We speak the patient's voice. The 3 founding families all were caregivers for their loved ones. And that is the core of our being, as well as our strong belief in the equity that is needed in this field. And so we started very early in our journey with African Americans against Alzheimer's, Latinos against Alzheimer's, and women against Alzheimer's as the 3 of the groups of our society that is most differentially and disparately impacted by this disease. So we have been working now for a little over 10 years, basically advocating in the field and participating in the field in several different ways, but all guided by the notion that we need to be able to understand how to detect this disease early and diagnose it early. As we've learned from any number of other therapeutic areas, cancer in particular, but most therapeutic areas, the earlier you catch the disease, the earlier you figure out that you've got it, the more likely it is that there's something you can do about it that will change its course. And so we've worked on a number of different ways to do that. We have worked with the federal government and the NAPA Council to develop a prevention goal, a goal of reducing the incidence of Alzheimer's by 15% over the next 10 years through preventative steps, lifestyle changes, greater attention to comorbidities like hypertension and diabetes. We've worked very hard in creating Alzheimer's disease patient and caregiver engagement, which is a deep dive, scientifically rigorous in understanding what patients care about most, which turns out to be something slightly different than what academics think that patients want. Patients very early in the course of their disease see a change of mood, and early psychiatric evidence of depression. And so they want a greater sense of urgency and agency in detecting those kinds of impairments in what we would call now the class of the working but also those that who sense that there is something wrong in them, and sort of those that are risk for the disease. We've also worked, as most of you know, very heavily in the brain health equity space, partnering with the CDC on interventions that in fact can prevent or delay the symptomatic stages of this disease. So BrainGuide was really quite an innovative idea, birthed in large part by Brooks Kenny. The notion that in fact, can we find a private way? Can we find a way that you can assess whether your worried well status is justified or not, and be able to test whether or not you might have some memory problems, which suggest the need to go to a physician. And so BrainGuide is just that in both Spanish and in English, the ability to go online or through a call-in to actually get a 3-word test that actually enable you to detect whether or not there is reason to believe you should see a doctor about your brain health status. And then there are a variety of resources that you can utilize to move through that process. But this is a very innovative, very novel, and as Brooks says, the first of its kind of tool that people can actually use to determine whether they are in the very, very early stages of Alzheimer's or some other brain health impairment that should cause you to go to your doctor, should cause you to take preventative steps in either lifestyle or managing some comorbidities like hypertension and diabetes. It is unusual. It's now in 1 year in. It seems like it's been here forever, but it hasn't. It's novel, it's new, and it has been visited by 200,000 people who have used it. And we are now utilizing additional sort of deeper dives on how to get people introduced to it and to use it and to make that personal assessment in private with no human intervention, but I found when I first got on board, I thought, who wants to talk to a robot? But my God, is that robot very soothing, comforting, and speaks to me and speaks in private. And so I very much love this particular product, and I think it's a terrific innovation in the field. So with that introduction, and congratulations to Brooks on getting us here over the course of a year, and to really setting this thing up, getting it going, getting it used, and experimenting with how best we can get people on board and using it. It is really quite an achievement. So I congratulate Brooks and our Chief Operating Officer, Russ Paulson, who did a lot of the deal work in putting this together with Amazon. And so, in fact, it is a real tribute to the entire team. So I appreciate the time. I appreciate the opportunity to say hello and to welcome our first anniversary of our launch. So back to you, Brooks.
Great. Thank you so much, George. And certainly don't need the thanks. It's been a team effort from a wide range of folks over the year and partners, and we will certainly be seeing more of that, but I certainly appreciate your kind words. So why we are here today ultimately, and why we even created BrainGuide, we all know the statistics that someone is developing Alzheimer's disease every 60 seconds, yet despite the numbers, most cases go unrecognized, most get diagnosed too late. If we were talking about cancer or heart disease, this would be an unacceptable reality. And so we really believe that people, millions of people have unanswered questions. So many people have questions about risk reduction, which is why we focus so much here at Us Against Alzheimer's on prevention and thinking about the modifiable lifestyle risk factors that we can actually do every day to improve our brain health and lower our risk of cognitive decline. But we also know that people that are experiencing subtle changes in their memory or thinking are worried, and they don't necessarily know where to turn. And they tell us they don't know how to raise the topic. They don't have the words, even to raise it with loved ones, let alone to raise it with a provider. We know this system has its own challenges. There's unclear incentives in the system right now for addressing cognitive decline. We know that providers, in particular primary care, don't have the confidence or in some cases the knowledge of what tools are available and when to bring them in to the discussion with their patients. And so we have a lot of work to do when we think about the gaps in the system, which is really, again, why we launched BrainGuide and why we built it, with input all along the way from people with lived experience as well as medical experts. So where are we 1 year later? We thought it would be valuable to just kind of kick things off with a brief clip from our GMA segment, which helped us launch and really get off the ground with BrainGuide.
This morning, a new online and phone-based tool that's totally free and can help patients or their caregivers get intervention early.
Doreen Monks, nearly 68, says she sees aging differently now.
Having Alzheimer's disease, you find that things which you may not have paid much attention to or felt important about become much more important.
For Brian Van Buren, with a family history of the disease, it was a matter of when, not if.
It wasn't a surprise, but once I got diagnosed, and that confirmed it, but it still felt like a punch in the gut.
Over 6 million people live with Alzheimer's, 65% women. And by 2030, 40% will be Latino or African American.
Unfortunately, especially within the Black community, mental illness and various other diagnoses are not talked about.
But to fight this, BrainGuide. It's a web and phone-based tool. Anyone can log on or call for a questionnaire. You can use it for yourself or answer questions about a loved one. Dr. Rudy Tanzi, a professor of neurology at Harvard, assisted in its development and says it's based on real diagnostic tools.
There's a questionnaire that is based on two of the best tests out there. The real need was for those who are starting to have memory issues, or the spouse who notices their wife is having some memory issues. And how do you approach the topic? How do you talk about it?
Too many times the person with the disease is the person who has to make the changes because you're embarrassed. I think that has to change too. You know, we're looking at millions of people. This is a large percentage of the population. You can't push those people into the corner anymore.
That was a perfect segue. I'm going to turn it over and spotlight Doreen Monks. Doreen has been part of our market research from the beginning of the development of BrainGuide. We could not have built it without her. So Doreen, would love for you to share with the audience a little bit about your story and a little bit about your own BrainGuide as it relates to your diagnosis and how you're doing today. Welcome. It's great to see you.
Thank you. Thanks, Brooks. Hello, everyone. I'm a retired neuroscience nurse practitioner and a program director for a stroke center here in North Jersey. And in fact, it was a program I'm honored to say I developed. And one day in March of 2015, just prior to my 62nd birthday, I got a knock on the door from my very dear friend who happened to be a neurologist, who was actually the medical director for the program. And she said, we have to talk. And she said, there's clearly you're having cognitive changes and we need to get this checked out. And thanks to her, a little bit after my 62nd birthday, I was diagnosed with younger onset Alzheimer's disease. And I will be forever grateful to her because I was diagnosed so very, very early compared to the general populace. And, you know, I got diagnosed, I had to leave work, sat for a while to sort of sort out what the heck happened. And they decided I had two choices. I could just, sit in the corner and wait for the archangels to come, or I could do something, because take advantage of the fact that I was so early diagnosed, and put that into action. And I focused on a few things. One was speaking on behalf of those of us with Alzheimer's disease who cannot speak for themselves, and showing them that there is a life after diagnosis. Second was, working, as I said on the clip, at getting Alzheimer's out of the corner. There's too many people. We need to have, this has to be recognized by society and research and the legislature, and the time has long past due for them to start doing something, or all of us to do something. And third, I just really wanted to work hard on helping others to get the same chance that I had. Not everybody has a Danielle knocking on their door, but we're going to find, I believe strongly with all my heart, that the research, treatment, and the cure is going to come based on the earliest moment of diagnosis. Especially now that we're seeing people in their 40s and 50s and early 60s being diagnosed. This is no longer an 80, 90-year-old disease. This is, many of us are at risk much earlier than we think. And that brought me to BrainGuide. And when Brooks asked me about it, I thought, I was a little skeptical, because what I didn't want it to be was like, this happy little diagnostic tool, and we're gonna scare the bejesus out of everybody. And I was so wrong about that. There's so many good things about it, and I was so honored to be a part of it. They put up with all my little comments and suggestions, but it's so easy to use. And more importantly, and it's easy to use for whether it be the person themselves affected or their caregiver, or someone, a friend who's concerned, hasn't even spoken to the person they're concerned about, but to get an idea of what's going on. And it's non-frightening, it's non-diagnostic, but it's clearly a chance to start the discussion. I was lucky. I'm a neuro nurse. I had a best friend who was a neurologist. I went to my doctor like 2 days after the discussion and got diagnosed. Again, it's a scary topic. And if you don't have that advantage, the problem is that way too late in the discussion is there an actual discussion with the physician. So what you get from the BrainGuide is this nice little handout that you can kind of hand to your physician and say, this is what I'm concerned about. And this is where I really want to look at. I used to tell my stroke patients, if you think you're having a stroke, you are until somebody tells you you're not. I want other people to, if you think you're having a cognitive issue, you are. Don't let anybody talk you out of it, but it needs to get investigated. So lots of reasons why that can happen other than any of the dementias, but it needs to be evaluated, and the other thing that's really, really wonderful are the resources that are available. I printed them out myself. I'm 7 years, actually more like 9 years after the onset of the disease. I'm clear to be, seem to be pretty okay. I'm living independently. I'm finding I've etched out a new life for myself, thanks to all my friends in the Alzheimer's world. And every day I get up and it's a good day until somebody tells me it's not. And if nice thing about a bad day is you go to bed and wake up to a new good one. So I'm very grateful. I will for Brooks for inviting me to participate. I'm so glad it's been such a success, because it really is a worthy tool. And I encourage anybody to talk to their friends and their family, somebody around the corner, somebody in the street, because again, the good thing about it is it's not going to scare you. It's not a diagnostic tool, but it gives you a starting point that too many people don't have. So Thank you very much.
Thank you so much, Doreen. Thank you for sharing your story. We truly believe that through storytelling, it's really gives us the opportunity for people to be empowered and to get rid of the stigma associated with memory loss and Alzheimer's disease. And so we really are so grateful to you for not only giving us great advice on BrainGuide. Our success is in large part based on your feedback. So thank you. And thanks for sharing your story. It's really meaningful to all of us, and we're grateful that you're here. So you've already heard what BrainGuide does and what it offers. You heard it through GMA, you heard it through Doreen. So I'm not gonna spend a lot of time. It's memory questionnaires based on trusted tools that are used often in the clinical setting today. We provide you with a tailored experience. You're not going to have pages and pages of content from a Google search. You're going to have a tailored experience when you leave BrainGuide, and you can always come back for more information. Since we've launched, we've added about 40 original articles. So we have about 100 original pieces of content within BrainGuide today, everything from brain health, risk reduction, and prevention through how to access local resources and how to live with Alzheimer's disease. And we want to continue to build those resources and that content. So we hope people can continue to utilize the resource. We built this with our team at Amazon Web Services, built the technology. I know many folks from AWS are on the line today, and we're super grateful for that opportunity. We received in-kind and financial support from Biogen. We're incredibly grateful to them for their support as we built out the platform. So where are we with the data? Well, we almost had 300,000 by the time of this call. I almost rounded up, but I have to be transparent. So we're at 292,000 all-time web users. But probably most importantly, we have had 170,000 people take a memory questionnaire, which we think is a pretty remarkable number. It's far surpasses what we set out for our goal in our first year. Most people are using it from their mobile device, which is interesting. Most are using the web chat. We have a couple thousand folks that are using the voice bot, but most are still using the web chat, meaning they're going to mybrainguide.org. Among those that are using the phone number, we have a higher percentage than when compared to the web of use in Spanish. So about 13% are using it in Spanish. And then when we think about whether they're taking the memory questionnaire for themselves or a loved one, remember, when you come to BrainGuide, you can choose whether you're taking this for yourself or on behalf of a loved one that you see often. And remarkably, about 81, it fluctuates between 78 and 81% of folks are taking it for themselves. Most are women, and the majority are between the ages of 60 and 80. And so who is using BrainGuide beyond that? Well, we've developed a series of personas, and you might recall me talking about the tailored page experience. We want anyone that comes to BrainGuide to have a tailored experience, personalized to them as much as we possibly can. So in year one, we developed personas. We put people in buckets and named them, and basically tried to build out the likely characteristics that would be part of that persona. So we have our Julias. That's about half of our audience. It's people who are worried, but they're doing well. When we ask them if they're concerned about their memory or thinking, they say no, they don't have a concern. So they fall in that kind of worried well category, and they score fine. They're able to remember all 4 words on the memory questionnaire, and we point them to brain health information, risk reduction. We point them to our 30-day brain health challenge as a way for them to continue to engage. And this is, again, tied to a lot of our prevention work that we talked about at the top of the hour. We also have about 45% of our audience fall into one of 2 categories, either caregiver or individual coming for themselves, where they actually answer yes when we say, do you have current concerns about your memory or thinking or that of a loved one? They say yes, and they score poorly on one of the 2 questionnaires. We really also want to make sure we focus on that group of individuals to ensure we give them the next step in their journey. What tools do they need? What do they need to be able to see in their tailored experience that's going to empower and inspire them to raise this conversation with their loved one or with their medical provider? I want to emphasize something that Doreen said. We are not obviously providing a diagnosis, right? We are not telling people that they have Alzheimer's disease. We are trying to get them to the next step on their journey. We're trying to get them to spark that conversation because we know these conversations are not happening. We often relate it back to the late 80s and early 90s when the public health movement started distributing shower cards for breast self-exam. I don't know if folks remember that, but we weren't diagnosing breast cancer with a shower card. We were trying to empower women to notice changes in their body. This is all we're trying to do with BrainGuide. We're trying to get people thinking about their brain as a vital organ and recognizing when things might be different, how they can actually raise that topic. How can they bring that into their discussions around their kitchen table and in their next discussion with their healthcare provider? So that's really what we're trying to do through these personas. What's interesting as well, as I said, is 81% of users are taking the memory questionnaire for themselves. And of those that say they're concerned, most don't have a diagnosis and many are scoring poorly on the questionnaire, meaning they're not able to remember all 4 words without without a category clue. On the same token, caregivers, so people that come and take the adapted version of the AD8, which is an 8-question test, they answer yes to 3 or more questions on that questionnaire on behalf of their caregiver, or on behalf of their loved one. And most say they are concerned. Most say their loved one does not yet have a diagnosis. So we really want to make sure we provide support to these individuals and get them the resources that they need. We have a regular survey that we put out for BrainGuide immediately after the experience. And the items noted here in blue, this is data that we've just collected in the last few weeks. These are folks that have been with us for a year, and we've been asking, are you taking steps to improve your brain health after going through the BrainGuide experience? Are you raising the topic with your doctor? Will you or have you considered bringing the printed summary to your provider? So we have a long way to go on kind of capturing the data and understanding what behaviors people are taking after their experience. But this is just a snapshot of where we are today. And largely folks are feeling more confident, more engaged, and more likely to participate in those conversations. We've had a really tremendous, we're really humbled actually by the media response from this effort. We think that what has really struck the media when we talk about BrainGuide, it's not about the tool itself. It's the statistics about why we are here in the first place. It's the fact that so many cases go unrecognized. It's the fact that by 2030, nearly 40% of cases will be among Black and Latino populations. When we share these statistics with reporters, they really pay attention. And so BrainGuide is just a resource to help bridge that gap. And it's been a really interesting year in terms of the exposure and the interest from the media to talk about this work. We've also had the opportunity to speak at a number of conferences and podcasts with many organizations that are on the line today, and we're certainly grateful for that opportunity. Most recently, we had the chance to launch a pilot program in Atlanta, Georgia. And this is really in keeping with our focus in trying to promote health equity from the beginning of our work. Health equity was never an afterthought in building BrainGuide. It was part of the development and our market research from day one. Our medical experts have provided us guidance. Our community partners have as well. We kicked off with former Surgeon General and board member, Dr. David Satcher. We did a town hall in Atlanta in collaboration with many partners in Atlanta, Georgia, including the Alter program, Black Health Matters, and Emory University. And we supported that by doing paid media. We did out-of-home digital media. We had radio ads, we had print ads, and a wide range of opportunities to raise awareness in that community. And what has been really fascinating is the amount of interest we've received. We've had a 96% increase in traffic in Atlanta between October and December, a 70% questionnaire completion rate compared to a 50% when you look at the national average. In one day, we had 5,000 people visit the site and 4,000 people take the memory questionnaire in response to a media clip that we had in the local news, which I'm going to share with you now.
9 people over the age of 45 will experience symptoms of dementia and Alzheimer's.
Less than half of those, Linda, tell their physician about increased confusion or memory loss. Channel 2 anchor Fred Blankenship learns the disease hits the African-American community twice as hard.
That's why Emory teamed up with the national group Us Against Alzheimer's to promote early testing in the Black community. I had the pleasure of speaking with a wife and caregiver of a dementia patient. She told me early diagnosis is critical to prepare for life with the disease.
My husband is my gift. Regardless of where he is mentally, he's my gift.
Malcolma and Kenneth Yagu have been married 19 years.
Being able to do the day-to-day things, to remember to take a bath, to not put all of his food in his mouth at the same time, have a conversation. Those are the things that I miss most about him. This is like my routine.
Since 2016, Malcolma has been Kenneth's care partner. That's when Kenneth was diagnosed with frontotemporal dementia, or FTD. Malcolma told me at first, Kenneth's symptoms were only noticeable to her.
Like spending, eating a lot of carbs, just things that were different. So I had to look further to find out what was happening.
For Malcolma, a member of Nigerian and African American communities, finding information and support was not easy.
So the African community, they didn't want to understand it. They didn't believe it. That's not what's going on with him. The African American community, they talk about or their grandmother or their grandfather. They don't bother them. And I'm like, you have to get involved.
It's nothing to be ashamed of. It's a brain condition.
Stephanie Monroe is the executive director of African Americans Against Alzheimer's, a part of Us Against Alzheimer's. While African Americans make up just 13% of the population, they account for a third of the total cost of Alzheimer's nationwide.
So it's bankrupting our families. It's really eliminating generational wealth.
This is not just old folks' disease. This is not a normal part of aging, which a lot of people do think that, especially in the Black community.
Dr. Fayron Epps works with families dealing with dementia and Alzheimer's.
What is the education that I can develop and provide to them and other non-pharmacological interventions to support them on their journey?
She says early detection of declining brain health improves quality of life, not just for the patient, but the care partners as well. That's why Emory partnered with Us Against Alzheimer's to promote MyBrainGuide. MyBrainGuide is a simple and confidential memory questionnaire that can be taken online or over the phone too.
At the end, you will be given information about what your next steps should be.
I took the questionnaire myself, and I admit I was nervous. But Epps says taking this step is nothing to fear.
I want to tell people, if there is some recommendation made that you follow up with a physician, it does not mean that you have a form of dementia.
She says something as simple as a vitamin deficiency could be to blame. Malcolma believes MyBrainGuide is a great start, but
once those questions are answered, then you need to move on whatever those answers are. It's hard to get someone to listen sometimes, but you have to be persistent. Don't stop knocking on doors.
Fred Blankenship, Channel 2 Action News.
9 people.
Great. So now I would love to introduce Marcia Henderson, a former Associate Commissioner for Women's Health at the FDA, and Adriana Flores, Assistant Professor of Nursing at University of Pennsylvania. We're going to start with Marcia, but I want to just thank both of these incredible women leaders who have been really with us from the beginning of building MyBrainGuide and have been providing ongoing support, feedback, ideas. I will never forget the conversation that you and I had, Marcia, when we were first looking at the content. And you gave us such great advice about how we need to tailor the content for different communities and how we can be thinking about accessibility. And we learned so much from your wisdom and would just love to hear your reflections on the last year. So Marcia, welcome.
Well, thank you and good afternoon. As has been said, my name is Marcia Henderson, and I'm a former Associate Commissioner for Women's Health at the Food and Drug Administration. But perhaps more importantly, I myself was a caregiver of a relative who had Alzheimer's disease. And so I take it very personally. And I was one of those people that had difficulty finding really good information. So I'm thrilled to be here with you this afternoon to celebrate the 1-year anniversary of MyBrainGuide. I was also a participant, as Brooks said, in the launch of the platform, and I still believe, not only do I believe, I know it's a game changer for health equity. For me, BrainGuide is about empowerment and fairness and health equity, making medical information available to as many people as possible in as many ways as possible. I come to this discussion also to offer another perspective. It's important to recognize voices from different communities in our fight against brain diseases. There are many findings about Alzheimer's, some of which have been mentioned, but I consider it unacceptable, for example, that 60% of cognitive impairment cases are not diagnosed. This figure would be considered unacceptable in cancer care or in heart disease prevention. Yet what is most disturbing and reprehensible is this: Alzheimer's is a disease that disproportionately affects women and people of color. 65% of Alzheimer's patients are women. And by 2030, less than 10 years from now, 40% of Americans living with Alzheimer's will be Latino or Black. We have to change this. BrainGuide gives us a long-awaited opportunity to do so in 4 ways. First, by making this platform free, we remove a cost barrier for underserved communities. Second, by making this platform accessible through both an internet and phone connection, we are getting critical information to disenfranchised communities. And we know access is as important in improving healthcare as cost and quality. The plans for further enhancements to the platform that we heard about today will hopefully make people get to local resources more quickly. Third, by offering BrainGuide with a Spanish language option, we're assuring that language is one less barrier for the Latino community to overcome in seeking better healthcare in America. And finally, there's no question in my mind that BrainGuide will be an Alzheimer's game changer for women. It has been said that if you build it, they will come. If you build it right, even more will come. And as Brooks has said today, hundreds of thousands have already started to come. Women play an essential frontline role, not only in the care, but in the prevention, diagnosis, and treatment of cognitive decline. And they have been coming in droves. We also know that women bear a much heavier burden emotionally and physically as both patients and as caregivers. This is especially important because women are living longer lives. BrainGuide provides women with one more resource, one more path to make their brain health journey an easier one for themselves and for their loved ones. And as we've heard today, women make up most of the BrainGuide user base. Most are over 60 and taking the questionnaire for themselves. That is powerful. To me, BrainGuide is the ultimate consumer engagement health platform for our generation, a timely catalyst for changing the way we approach brain health. So as George said at the top of the hour, there is much to celebrate today and much more work to be done. Thank you for letting me give my testimony today. Now I'll turn it back over to Brooks.
Great. Thank you so much, Marcia. And again, thank you for your leadership and guidance. It's been so valuable to all of us. Adriana, welcome. We're so thrilled that you're able to join us today. And likewise, you've given us so many pieces of advice specifically around Latino communities. And I know we've talked a lot about bringing this resource to the community in Spanish from day one, and you've been instrumental in helping us do that. So we'd love to hear your reflections and how things are going.
Absolutely. Thank you so much, Brooks, for your leadership and the outstanding team at Us Against Alzheimer's and all the partners and colleagues that I've had the opportunity to work with through this work. You know, as a nurse, I've been a nurse for 20 years. I've been a nurse practitioner for about 15 years. So this is something that I see, up close and personal, because I practice in an area that's predominantly Spanish speaking, predominantly immigrant, migrant communities. And so these are families that are often an afterthought. And I think the way you talked about inclusion with BrainGuide is so important. And that is, especially with Spanish being such a, so many Latinos in the country, and this number continues to grow. When something is built, in research, we first do everything in English and test it and refine it. I love the approach that the team here took, and that is to bring both along, because you can do all of that figuring out together and find out the real issues at the same time. And so I think that this is a better approach. It often takes 17 years to put something into practice once it's developed and tested. And I have seen how unbelievably, this is an example of how we can do better. We can do better for our country, especially when it comes to cognitive health, to memory health. And so for me, my experience has been that one that I'm not surprised, as I've gone through in the research that I do, sharing this with families of participants that are, we know have a memory problem, so they're with us for a different reason. And for families, though, that might be at risk, we've talked about and shared the guide. And they're always so shocked to know the numbers, the inequities, and that they've never had a memory screen. And we're talking about people 50 and older that have never been screened, that have never, seen anything like this. And the fact that it is not only in Spanish, but it's offered by phone, it's accessible, it's free, and that it does reflect the community as well. Yes, it's in Spanish, but as you said too, it's been culturally adapted. I love the images that you show, that shows diversity across, that shows a lot of different people. And that has been very well received by the community. The fact that they see many different faces reflective of our community is something that is very well received. As you said, I was a part of some of the Spanish media that we did. And again, in the questions that we received through media, people just the awareness that BrainGuide promotes about memory health is number one. I think a major goal that we've been able to take the communication to the Spanish speaking community, to number one, educate about memory health, BrainGuide, brain health, and then offering something too. I love the team's vision for action. Yes, we've done a lot of education and awareness, but now what can we do? And so I think BrainGuide offers also that next step of serving as an assessment tool, a very credible assessment tool that then, whether you're taking it for yourself or your loved one, serves as a starting point for discussion. I've heard from colleagues, friends, and even students. I wanted to share that I've also shared it with future nurse practitioners, and that they say, we started a whole discussion in my family about it. And so I think this serves as that starting point where families can have a discussion in the privacy of their home. They could share results, they could keep them for themselves, but that it doesn't make them feel like they're not aware of or not have access to these materials and resources. So I've been very pleased. I love the questions in the chat about future directions, and then following up with those that have used it to learn what their experiences have been thereafter. I did have one colleague that shared it and did take her results to her provider. And I loved it because as a provider myself, I'm very happy when patients bring what they're learning outside so that we can talk about it. And her provider was very open and happy that, she brought this information forward, because I think providers want easy tools that we can put as part of our daily toolbox. Unfortunately, I think the pushback we get is from large organizations, the more at the policy level, like we don't want to use this, we want to only use this, or we don't want to do this assessment because of whatever reason. So I think the community is ready, and I'm looking forward to continuing to move this work forward because I've seen clearly that it's needed. Families and individuals are open to it. They've welcomed it. And I think that the numbers speak for themselves, and 13% Spanish speaking just means, you know, we will continue to work to promote this out, especially in communities that have high Spanish speaking residents. So I look forward to that work with you, Brooks, and the rest of the team here. And thank you for letting me share.
Oh, thank you so much. It is so great to hear. I love that people are starting to tell you about their experience. I love that you're talking to medical students as well. And really hats off to our health equity team here at Us Against Alzheimer's, which, as you know well, led by Jason Resendez and Stephanie Monroe. And, you know, they've really been instrumental in helping us ensure that all of the lessons from our decade of doing health equity work were reflected into everything from the words we use to the photos and to the outreach to partners. So thank you for being here, and thanks for keeping getting the word out. We're really grateful. We're really grateful. So just in wrapping up with folks, I just want to share a couple of points about looking ahead. I've had a lot of questions in the chat and welcome them. We definitely have learned a lot this year, and we have to kind of focus on what the next year is looking like. We want to continue our work in Atlanta and other communities that serve Black and Latino people. We feel very strongly, as I said at the top, and as we've been talking about throughout the discussion. And we also want to test the idea around a more tailored experience for the personas that I mentioned, the Julia personas around risk reduction, and the personas around the Ben and Anson, for anyone that's keeping track and memorizing our names. They feel like friends to us. But those are the folks that don't score well on the memory questionnaire, and they tell us they're concerned. They're coming to us saying they have a concern, and we want to make sure that they have a really tailored experience. And so as we think about moving forward in our second year, one of the areas that we're testing out right now we haven't launched it, but it's going to be tested in Georgia. And this is directly in response to the community partnerships that we've built there and what feedback we're receiving. We will be able to identify folks that come to the platform from a Georgia zip code. So if they come to us from Georgia, we are going to be able to populate that tailored experience at the local level, where we will provide specific resources in Georgia for people to access right when they get the summary of their results. So they don't have to wait and go back to the site and look around, but they can actually have it right there. So immediately giving them access to a resource. And we're going to be able to tell how many people click on that website and click on those links. We also recognize that there's a mix of audience in terms of what people might have access to, of course. So some folks may have insurance, but not have access to a healthcare provider. Some folks won't have insurance or a provider. And some folks might need help understanding what the next steps are in bringing that information to their provider. So each of these steps that you can see here on the screen are really aiming to get more specific to a particular need that someone has. We also recognize that those are a lot of options for folks. And this is why we're piloting it. We're trying something based on feedback. We're going to be able to measure it. We're going to attach analytics to it. So hopefully we can answer more of these questions that are coming up in the chat. Well, what are people doing? Are people taking this summary to their provider, and how is that being received? And what was the ultimate result? So we're looking forward to adding those enhancements. We also really want people to stay in touch with us. So we're looking for new ways to capture emails. I want to be really clear. One of the core values of this product is we want to reduce any barrier to entry as possible. So we are not requiring people to give us their email in order to receive the summary from their questionnaire, because we know that that can be a barrier. So many people do give us their email, but not everybody does. And so we're trying to look for ways to hopefully capture those emails so that we can stay in touch with people and follow them in their journey. We're also looking to expand our resources around, okay, what now? I got these results in the memory questionnaire. How do I bring this up with my loved one if I took the adapted version of the AD8? Or maybe I need to communicate with my my doctor about myself and I don't really know how to raise the topic. I don't know when to bring it up. I don't know how. So we're trying to bolster those resources to make it easier for folks to do that. We also have a provider engagement strategy as well. And we have developed risk reduction guidance related to Alzheimer's disease and reducing cognitive decline based on the risk factors that have been well established and published from Lancet Commission and others around lifestyle, nutrition, physical activity. Many of you on the call today, Adriana included, was part of that work. And so we've included that risk reduction guidance within the BrainGuide platform. We've also developed provider-focused tools. So is there a way to bring BrainGuide into a provider workflow that's easy, that's accessible, and that actually reduces the issues around time, and maybe give folks a postcard or a flyer or something that they can do at home, and then in the next appointment have those conversations. So we definitely are working through that strategy as well. Just a couple quick lessons learned, and we could talk for a long time about each of these, but I would say number one is removing all barriers to access as much as possible. We want BrainGuide to be accessible in English and Spanish to anyone that has access to the internet or a telephone. You can use the phone number from a landline and still experience BrainGuide. We invested a lot in market research from the beginning and ongoing. We did about 25 one-on-one interviews, even in this first calendar year since our launch. We did both Spanish speaking and English speaking users. We really wanted to understand the audiences that we were serving. From day one, we aim to collaborate with people that have lived experience, that are living with Alzheimer's disease, like Doreen, caregivers of people with Alzheimer's disease, medical experts, and community partners. And that's an ongoing effort so that we can keep learning. We don't want to live in a bubble of BrainGuide. We want to continue to talk about it and gain insights and feedback from the collaborators and stakeholders that we work with. We're also always testing these ideas in the local community. As I shared, we've had a high level of engagement in Atlanta, pretty remarkable compared to the national average. And we have invested a lot of resources to ensure that. And now we have partners in Atlanta that are bringing BrainGuide into the church community, into community centers. And we want to make sure we're listening to those partners and their feedback as we tailor the experience. So the local effort has really been exciting. And obviously equity is foundational to our work. It's been part of the BrainGuide discussion from day one when we were looking at a blank whiteboard, and has continued to be part of our priority moving forward. So in closing, I just, again, want to thank all of you for being with us today. I want to thank those of you who've been with us from the beginning for sticking with us, and really invite any and all ideas. This is a free service. We are a nonprofit advocacy organization, and our goal is to reach 500,000 people. We don't want to just reach a few 100,000. We want to change the conversation. I'm saying in this year alone, 500,000, but ultimately we want to reach millions of people to spark that conversation and to engage in risk reduction. So we invite you to help us think about that, whether you're a company, whether you're a nonprofit, a community leader. If there are ways that we can make BrainGuide accessible to you and the people you serve, we'd love to do that. If you have meetings or conferences or ways that you could envision us participating, we're happy to discuss. And we really would love any ideas you have around BrainGuide in terms of its enhancements and the resources that we're providing. I had a lot of questions in the chat, and I know there's some more there, which I need to get to, asking about how we're measuring the impact. We'd love to partner with groups that are on the call today to talk about measuring the impact, to actually see if we are able to get more people into the healthcare system funnel and ultimately increase the likelihood that people will either get answers or get an appropriate diagnostic workup so that they can get the support that they need. So we are really open to collaboration, open to idea sharing, and hope that you'll reach out and talk with us about ways that we might work together. So with that, I just want to say thank you. Thank you to our speakers that joined me today, George Friedenberg, Doreen Monks, Marcia Henderson, and Adriana Perez. And I know we have some questions in the chat, and I see Michael has his hands raised. So I'm going to turn it over to you, Michael. If you want to ask your question, we have about 5 minutes.
Thank you so much. And this is a fantastic tool. I have to tell you, I think I might have tested it, but I don't remember. And that's the key. If I go back to this, will this let me know that I've done it in the past? Because I think it's probably something important for people who are living with dementia who may not even know they've done the test.
Yeah, that's a really great question. So our system can recognize repeat users, but we do not have any user profiles or anything like that on the system today. Based on the research we did, we didn't want to have anybody have to create a username and password, because we know that that can reduce the likelihood that people will come. But I will tell you, we have many different word sets within the memory screen. So there are multiple variations of word sets, some upwards of 3,000 variations. So you could come on it more than once and get a different set of a different set of words to go through. But right now, we don't recognize you specifically and say, hey, Michael, great to see you back again. And that was really a decision in the design phase of the work to not have any barriers. But I appreciate and can really appreciate your point of view, and we'll definitely think about it. Are there other, I'm trying to read the chat real quick. Are there any other questions from participants or anyone want to make a comment before we close out? Okay, well, with that, I'm gonna end the way I started with our gratitude to all of you for being with us today and for tuning in and sharing your comments. We will save the chat and we will share back out with you a recording of this, and you're welcome to share it with others. I also want to thank Kelly Jackson, who is still on the screen. Maybe she can give a wave. Most of you know Kelly has been with us since the beginning of BrainGuide and organized this entire briefing, and has, I know, a name you're used to seeing, but maybe a face you haven't seen a lot. So thanks to Kelly for her great work and commitment to this project. And with that, thanks everybody. Have a great rest of your afternoon and stay in touch. We hope to talk again soon. Take care.